So how does it get diagnosed in the vet? And this is one of my biggest pet peeves whenever it comes to the veterinary industry and how they do things, because I don't think they do things correctly, and I'm going to explain to you why. So what your vet is likely to do is they're going to run some blood tests, and they are going to check for elevated pancreatic enzymes like lipase. So they are looking for something called hyperlipidemia, hyperlipoproteinemia, which is the inability for the pancreas to break down lipids, to break down fats. Hyperlipidemia, it's called. And so they are going to associate fat with a low-fat diet, and I'm going to explain to you later on in the video why that is the completely wrong approach. You should not automatically see a high lipid count and associate it with a high fat diet or a low fat diet, and I'm going to explain to you why later on in the video. But that's not very reliable. Sometimes the most reliable one is the pancreatic specific lipase, and that is the most reliable because it comes from within the pancreas. Other diagnostics is a complete blood counts, abdominal radiographs, like if we take a photograph of the abdomen, and then ultrasounds to confirm inflammation or other abnormalities. But the most common one is elevated lipid levels, hyperlipidemia, and the vet is going to give you a bag of dog food, which is low fat, and that's going to be the course of action. And that is not what you should do, because hyperlipidemia, excess fat in the blood, is caused for a lot more from other sources than actual fat. And I'm going to discuss that later. So the prevalence, this is up to 64% of certain dogs and certain cats have some sort of pancreatitis or some sort of pancreatic deficiency.